I'm Mabel Jong. You are watching continuing coverage of the World Healthcare Congress here in Washington, D.C. A very warm welcome to those of you who are joining us virtually. I'm so pleased to continue our interviews today with Jesse Cureton, who is Chief Consumer Officer at Novant Health. He's based in North Carolina. Good to see you again.
Mabel, good to see you as well. It's always great to be here at the World Health Congress and meeting a lot of cool people and learning a lot of cool things.
Well, we're glad to have you, and there's always something new to talk about. And at Novant Health, you're really addressing issues with an increasingly savvy consumer.
Absolutely.
What sort of strategies do you have to deploy to meet the consumer where they are at?
Well, first of all, at Novant Health, we like to start with remarkable patient experience is important to us. It has always been important to our organization. But what I will tell you, where we've been more intentional, particularly over the last 5 to 6 years, is really informing what we do by talking to our consumers. Approximately 3 years ago, we actually surveyed all of our consumer populations within the major markets in which we exist. And as we surveyed the population, there were some things that came out that we found very interesting and fairly universal. The three key areas were that our consumers really wanted access, and they defined access more broadly than they had ever defined access before. They defined access by having clinics that were open 24/7. They defined access by the ability to communicate through the telephone or through the internet or through email. The second thing that was universal was our patient populations wanted transparency. And by that, they wanted to know how to navigate through the system. They wanted cost transparency or cost certainty. And then the third universal truth around that survey was really around the use of technology, meaning today's patient population, you would expect that for the millennials, but they really want us to use technology and see technology as a complement to their interactions with our organization. Now, with our organization, what that means is, we've used video visits as an opportunity to communicate with our patient populations. MyChart, you've probably heard of that through other systems. We are probably one of the largest users of MyChart. We have over 700,000 patients that are using MyChart to communicate with their physicians, to test, to check on any tests that they may have had, to find out or get information around their prescriptions, or just to overall communicate with their physician. We have received some 16,000 appointments through our organization through MyChart, and so those are some of the things that our consumers are telling us. The other interesting thing I will tell you that is probably a little unique and we think is somewhat proprietary to some of the work that we're doing in listening to our consumers. In addition to the three universal truths, we identified that within our patient populations, there are segments. And from those that are eager and engaged with our organization to those that are uninterested and not engaged. And clearly, as you know, in healthcare, particularly in a value-based environment, whether you are engaged with our organization or whether you are cost conscious or whether you are unengaged, we want to communicate to those patient populations. We also found out as we looked at these patient populations in the various segments and various demographics, social demographics, predominantly women, we understood that their behaviors and their attitudes were different and how they place a value on a primary care physician in the process of in connecting with them versus an advanced practitioner could be different. And so we think we're better positioned to really delight our patient population because of this information.
Do you have a feeling at all in your efforts to communicate and be transparent that the consumer is becoming increasingly fatigued with all of the information being thrown at them? And if they are fatigued, how do you really break through and still reach them?
Right.
Because we're saying things like email and other social media outlets that may be of use, but people are just inundated with so much information coming from many sources.
So we haven't found so much that our patient populations are fatigued. We're finding that they're far more educated. We're finding that they're far more engaged. And so really the value of segmentation is to communicate with individuals in ways that they want to be communicated with. So those individuals that really do not want us to communicate via emails, we're not. And we're finding that there's some of our patient populations, they prefer to reach out more proactively, or they prefer to talk to a clinician. And so that, in my view, is really the value of having a consumer-focused business. We're going to respond to our consumers in the way that they want us to respond to them. Overall, we're finding consumers to be far more engaging and far more educated, which is a good thing. We also utilize community strategies, community wellness strategies, free clinics, free screenings as a way of communicating to our patient population as well as our non-patient population. And last time you and I talked, we talked about the consumer in a non-patient consumer population, the patient consumer, and then this aspirational client-patient relationship. That non-patient bucket are really is still about 40 to 45% of the population that's genuinely, for the most part, healthy, but that's a population that's not walking into our acute facilities or our clinics. We have to communicate with them as well, and we've gotten really creative in how we do that.
It's always great to check in with you. What might we be talking about next year? What are things you're working on? Well,
so, I was with a group of clinicians and health executives about a month ago, and I proposed a challenge to them. I said to them, if we accept the fact that over the next 10 to 15 years, 70% of the interactions that we have with our patient populations will not be through brick and mortar, what would that cause you to do today, and how would that change your strategy today? And what I was implying is that there may very well be a day that 70% of the interaction, when you think about wearables, not just from a activity standpoint, but the ability to diagnose, to give diagnostics, thank you, as well as information on blood pressure and diabetes and those kinds of things. The day may come where we can interact with the patient population without them actually ever coming into a brick and mortar facility. So if that's indeed true, and you parallel that with this value-based care strategy, what are the things that we should be thinking about? And so the answer to your question is we have to continue to keep the patient consumer first. We have to be innovative. We have to think of vertical and horizontal integration in ways that we've never had before, meaning we have to be willing to partner to new players in the healthcare space that are non-traditional partners within the space. The biggest disruptor in healthcare is going to be the consumer. Yeah. The educated consumer. This millennial population will continue to age out, and their expectation on how they interact with us is going to be about now. Yeah. I want an appointment now. I want to be taken care of now. I want information now. And what does a now environment look like for healthcare? To me, it's pretty fascinating. Yeah. It's kind of fun to navigate and figure it out.
Well, we look forward to catching up with you again. Jessica Cureton,
Mabel,
thank you.
Thank you so much.
Thank you. And thank you for tuning in. Still to come, comments from Geisinger Health System and AARP. Stay tuned.